My name is Dan. I'm a retired medical physicist and also retired from the Air Force. I've been dealing with male pattern hair loss for a long time. I've done a lot of research. I've had 3 micrograft hair transplants done by a board-certified cosmetic surgeon. I've used minoxidil, Propecia, and I started hearing about stem cell being used in other medical procedures, and so I began to get curious as to if it could be used for hair transplants. And I've been dealing with male pattern hair loss quite some time. For me, it came on very early. I have a strong family history of early male pattern hair loss, so it affected me in mid to late 20s, as early as that. And it's for me, it's not so much that I couldn't deal with any type of hair loss, but the amount of hair loss in a short amount of time, that just, as early as it was, it just seemed like a little much for me. And it was something that hit me early on. And I just thought, wow, this is something that I want to deal with this young. I don't want to say crushed my self-esteem, but it was not pleasant looking in the mirror, being so young and experiencing so much hair loss at such a young age. I was not happy about that. So yes, it did affect my quality of life. I tried just about everything. At the time, Rogaine, topical Rogaine had come out and was later just a generic minoxidil. I did a lot of that, put a lot of Rogaine, a lot of minoxidil on my scalp. Didn't really see any results. Then Propecia came out, was on that for at least a year and a half, didn't see any real results, and was concerned about the side effects because if you look up the generic drug after that, there are some unwanted side effects that most men would not want. At that time, this would have been in the early 2000s, 2003, 2004. I did not know about stem cell, so I started looking at micrograft hair transplants because that, at the time, that was state of the art. And so I did seek out a board-certified cosmetic surgeon who was doing micrograft hair transplants. He did them routinely, he was very experienced. And so I had 3 of them done. And I believe the surgeon did a good job, but the issue that I ran into was, 1, I started running out of donor area, and 2, the scarring on the back of my scalp was just something that you can see and it didn't look good. So at that time, I decided that another hair transplant was just not an option for me, and I was just gonna, unfortunately, be stuck with the results that I had after those 3 surgeries. And that was, you fast forward till about 2020 when I started hearing about stem cell. As a retired physician assistant, I have some medical background, and I was familiar with stem cells in and of themselves. My ex-wife and I had done placental quartz stem cell harvesting. We're banking our children's placental stem cells through another company. And so I had some basic knowledge of stem cells just from some reading that I had done. But then I started to hear about stem cells specifically being used in other countries for a variety of medical treatments, not necessarily related to hair loss or even anything cosmetic. I just got to thinking, gee, I wonder, is there such a thing as stem cell therapy for male pattern baldness? And sure enough, so I Googled and researched, and all of that process is what led me to discovering the stem cell, hair loss therapy. In researching the providers that treat stem cell hair loss, I think there's a little bit of confusion when you bandy the term stem cell therapy for hair loss. There's a difference between, I think they're called platelet injections or the injections that they do in the scalp. But for me, I wanted a company that actually harvested stem cells from a viable, reliable source, bone marrow, and would use that and not some platelet injections. So a lot of providers out there that will advertise that, we're using stem cells, at the end of the day, it's really not genuine stem cells in the truest sense. So I clarified this with the patient outreach coordinator. I said, now, tell me exactly, where do you get these stem cells from, and are they actual stem cells? So between, I guess you could say, the authenticity or using actual, no kidding, stem cells harvested from your bone marrow, receiving some of those stem cells in a solution via intravenous fluid, I saw positive benefits to that. So that's what got me hooked. So I had probably at least 3 or 4 conversations with the patient outreach coordinator. I think what gave me some reassurance is that this individual had the procedure done for other reasons, not hair loss, but had actually gone through the procedure. So this individual was able to walk me through the entire process and So I knew full well what to expect before I even set foot. Overall, just the plethora of information, the amount of detail that I got even before I set foot in the clinic was just very reassuring to me. I knew exactly what was going to happen before I even flew up to Chicago.